Hello and welcome to Security Analysis, a weekly program on security issues, which is part of the Bharata First platform. I am Uday Bhaskar. This program, as the name suggests, will review contemporary security matters in an informed and objective manner, the aim being to shed light and add to our understanding of developments that are relevant to national security and in the strategic domain. This week, the focus is on the major national security challenge that India is grappling with, which is the COVID pandemic and the vaccination effort, which has a direct impact on India's human security. The question that we will seek to review is the role of the military in the management of the COVID pandemic and how best to understand this issue. It may be recalled that the Indian military, or what we refer to as the Fauj, was entrusted with creating quarantine facilities when the scale of the pandemic was first acknowledged in March 2020, that is last year. Then we had the Indian military bringing stranded Indian citizens back to India from different locations abroad. And over the last few months, when the scale of the COVID and more recently the second wave has led to a situation where the Indian military was asked to ferry medical equipment at very short notice. We had oxygen containers being brought from different parts by the Indian Air Force, by the Indian Navy. Field hospitals have been set up by the DRDO and manned by medical personnel from the military. Air conditioning plants, oxygen plants have been repaired wherever the military could step in. And all of this is something that is part of the national effort. As the country is preparing to fight the coronavirus and its spread on a war footing, the issue that merits review is that India's most credible war fighting institution, the Indian military, does it have a role? If so, what is the most prudent way of assigning a role for the Indian military, even as some elements are grappling with the cyclone as its follows? There are many strands to this. And to discuss this issue, we have a truly blue ribbon panel. I am very glad to introduce and invite, first of all, Professor Jacob John, who is the domain expert. Professor John is counted among India's leading epidemiologists. He's been a pioneer in viral research and is currently at the CMC in Vellore. He has a very long CV. It's illustrious. There are many awards, but time does not permit me to go into them, except to say that, Professor John, we are very glad that you could make the time to join us, despite the various medical issues that you have to address at this very point, even as we speak. I'm also very glad to invite and introduce Mr. Keshav Desiraju. He's a very eminent civil servant, recently retired from the Indian Administrative Service from the Government of India, where he was a secretary. Amongst the various positions that he has held, he's also been health secretary, and post-retirement, he is now an author. He is with various NGOs. And Mr. Desiraju, I hope that we can invite you again, because I just noticed that you're one of the few authors who has done 2 books at either end of the spectrum, which is Health Practice in India, Including Corruption. And you have a book on MS Subbulakshmi. I think that's a very, very interesting. Congratulations. I hope we can bring you on board it. Thank you so much. That is truly a gifted voice. And of course, we also have on board with us Lieutenant General Philip Campos. Philip is a very dear friend. We've been in the service together. Retired as the Vice Chief of the Army. And as military careers go, General Campos is truly part of a blue ribbon panel. He's done everything that a senior military officer would aspire to. And again, if you've got a detailed CV, Philip, I was very impressed with the fact that you are one of the few people that I know who's done 2 UN assignments, one in Yugoslavia, one in Iraq, and now he is a distinguished fellow at one of our think tanks and is addressing national security in all its facets and complexities. Welcome, gentlemen. In the interest of time, what I will do is to first turn to General Campos. General Campos, there's been a lot of debate, discussion, writing in India, on television, in print, elsewhere, about the role of the military. What it has done has been commended, but the way ahead, if you could share your thoughts, General Campos.
Thank you, Commodore Bhaskar. I'm one of those who believes that the military has a role, a mandated constitutional role, because a secondary role of the military is in disaster management. And considering that this pandemic is a national emergency and one of the biggest natural disasters that this country has faced, it is but natural that the military will have a serious role to play in this. The military has started hesitatingly, I would say, because last year the role was very muted, except for going around, bringing some succor to people here and there. But this year, with the second wave having come in, the military has played a more dominant role. And I feel the military can do much more, because the second wave isn't over. The second wave is spreading into the small towns and rural areas. And though the military has done a few things in the big towns and cities, especially where the bigger headquarters of the military or the formations are located, like in Delhi or Pune or Ahmedabad, Chandigarh, Faridabad. There are lots of places wherever the military is physically present, or the headquarters are present, they are sort of using the civilian facilities, expanding on them, and providing COVID facilities. And that's the major role which the military is doing, and it's expanding. It's now almost, I would say, there must be at least 20 cities where the military has got some COVID care center. And other than that, the military has opened up its facilities up to about 10 to 15% of its beds for COVID care for the civilian patients. Other than this, the transport facilities of the military, they are being used. We have used them to bring oxygen plants, oxygen cylinders, concentrators, moving medicines, moving medical personnel. This is again something which the military has been doing and can continue to do in the future. Other than this, we have got the logistics supply chains of the military, which are very efficient. They spread across the length and breadth of the country, and they can be used to move medicines, vaccinations, medical equipment. They can move it very efficiently, very fast, without problems that we are facing, like hoarding or black marketeering or things like that, which we keep hearing about. The military can get over all these problems and move things more smoothly. And the last point.
Okay, go ahead. Yeah.
And the last point I'd like to make is the use of the military veteran community, the medical veteran community who have retired. They are in their towns, cities, rural areas, including those below officer rank. They are being used very effectively now to help in spreading the message, educating the people, and on not only on COVID issues, but on related preventive matters.
Thank you, Philip. I'll request you to, come back to this one issue later, which is, can the military perform all these roles with its existing resources? But I'll, as I said, get back to you. Let me turn to Professor John. Professor John, if I could request you as India's leading epidemiologist, saying that the task ahead, as I see it, I'm a security analyst, for India, at a strategic level, at a macro level, is to vaccinate almost 1 billion people. And we are talking about 2 jabs. So given the scale of this and whatever has been said about the military, what is your sense about the way ahead, Professor John, and the military? Over to you, sir.
Thank you very much. The purpose of vaccination can be divided into three purposes in this priority order. First is to prevent death in those who are vulnerable to severe disease and death. Essentially, senior citizens above 65 years and those with comorbidities like chronic lung, heart, kidney diseases. And so if we could target these people on an intensive manner, we could have saved a huge number of lives if vaccines were prioritized only to these people and not distributed on a wider scale. The second purpose of vaccination is to open up a particular area. If you want to open up schools, then you target it around the school, staff, students, etc. If you want to open up transport, you look at the transport system. So like that, you could, if you want to determine which service do you want to vaccinate first and open up for economic purposes. The third purpose of vaccination is what you just now mentioned, to reduce the burden of infection in the whole community. That is the last priority during the height of an epidemic, when we are faced with not sufficient supplies. Then you do not distribute the vaccine on an equity basis. You determine the priorities, and the first and foremost priority is protecting lives, then protecting the economy, and then try to get the country, get rid of the epidemic. Would you want me to go into the military
I just
issue?
want you to address one issue, Professor John, which is, you have identified the priorities. Do you, as a doctor, as an epidemiologist, envision any kind of role for the military? Because to me, again, as a layperson, for India to vaccinate 1 billion people or thereabouts could take the whole year. So in that sense, as a doctor, do you envision a role for the military?
Yes, of course. We are a culture not very good at discipline, whereas we have the services who are extremely disciplined group of people available to the country. Now, as General Campos mentioned, this is an unprecedented call for India to vaccinate adults, which we have never done. The vaccination program so far has been confined to 2 groups, children below 5 and pregnant women. We have not had any platform of immunization for a wider age group.
Thank you very much for this point about the scale of the vaccination now, and the fact that you do see a possible role for the military because of its own characteristics. I'll turn to Mr. Desiraju. Mr. Desiraju, if I could request you to come in, you've been a senior civil servant and you headed the health ministry as the secretary. So having heard these two experts and having seen the nature of the debate, what is your own response? Is this something that could be considered at the highest levels as a policy issue, apart from the tactical issues that we have already addressed? Lifting cylinders, providing relief, quarantine camps, all of that we are already aware of. Mr. Desraju, all yours, sir.
Yeah, thank you very much. I think General Campos made some very important points. What he described as a secondary function. And I think there is no dispute that at this time of crisis, there are a large number of logistic, transportation, admin related jobs, which the military is best suited to do. For instance, movement of persons, emergency evacuation, construction of temporary hospitals, construction of temporary COVID wards. These are jobs which are, I think, essential. They need to be done, and the armed forces are well positioned to do it. That, I believe, is something should be done. Secondly, military medical facilities exist across the country, and many of us know from experience that the army tends to be very territorial about who can access these facilities. And while that may be okay at normal times, at a time of great humanitarian crisis such as now, there is a strong case for the military medical facilities, such as army hospitals and such like, which exist in every cantonment and elsewhere in the country, should, in my view, open up a little more, whether as vaccination centers, whether as emergency COVID wards, or whatever, without insisting on the fact that they are only meant for the treatment and care of military personnel, which is a normal, should we say, peacetime view. What I'm a little doubtful about is certainly public health needs trained, and then to use Professor John's words, disciplined workers on the ground. I don't think these should be army people. The government should have been looking in the past and should now look at putting together public health workers, as it were, who are trained, but to believe and to expect that in addition to logistic and transportational and admin jobs, that military people should be made to perform essentially public health tasks, vaccination, or even running a hospital, or being just bodies on the ground because the health system doesn't have them, is not, in my opinion, a correct way of going about it. These are jobs that government should entrust to public health people, and if we have made mistakes in the past and not created these public health armies, we should do so now. One last thing: government, state government, central government have all been severely criticized for the manner in which the police have been used in enforcing lockdown. Now, you will say to me correctly that there's a huge difference between the police and the military forces, but it is indicative of what government is capable of doing. We do not want, I live in Chennai, and Chennai, I believe, is better than other places, but we have seen terrible stories from the north of how lockdown has been enforced using men in uniform from the police. That is not something we want to do to our army, and I think we should be careful about it. Thank you.
Thank you. Mr. Desiraju, if you can hear me now,
Yeah.
I wanted to ask you one more question, if I may.
Yes.
Which is, both you and Philip Campos have spoken about the nature of the challenge, the unprecedented humanitarian crisis that India is now facing. I also spoke about the need for a response that's on a war footing. You've been health secretary and you've been in the government of India in different positions over the years. Do you recall the Indian health minister being invited to the Cabinet Committee on Security? And have you, as the senior civil servant, ever prepared a paper about the nature of the public health challenge and why it could be considered by the TCS. I just want to understand how the GOI works at the level of higher policy making.
The answer to your No, the answer to your question is no, I have not, in my experience, known of a health minister being called to the Cabinet Committee on Security. But it is also true that the years in which I worked in the health ministry, there was no such crisis situation that may have necessitated that. On a much smaller scale, there was swine flu in 2009. Whether the health minister at that stage was called in, I am not aware, but it was big for the time, but it is much smaller than what we are facing today.
Thank you. I think that I just wanted to give a little clarity on that. Why I'm raising this is because I think when the history of this pandemic is recorded, I hope we as citizens would get a sense or idea about whether or not the CCS, the highest body in a democracy, a parliamentary democracy like India, the Cabinet Committee on Security, which is headed by the Prime Minister and has certain key ministers, had looked at the pandemic at the highest levels of governance. And if so, what was the input from the health ministry? But I'll leave that aside for now. Maybe at a later date, we can visit this. General Campos, can I request you to respond to these two issues? What Mr. Desiraju has just said, that it may not be a good idea to bring in medical personnel from the military because of reasons that he has identified. While at the same time, you had spoken about the secondary duties. Why I'm asking you to respond to this resource issue is, in the first year of the COVID, if you remember, when Galwan happened, there was a sense that in the first 3 months of the year, certain activities related to training and so on could not be conducted as was the norm because of the COVID disruption. And if now in year 2, the HR of the military, particularly for the army, is already under stress, can we man all the COVID-related facilities and also discharge the equivalent of the primary function, even hospitals, for instance, because hospitals have got serving personnel and retired personnel. And from all accounts that you see in the media, it appears that serving personnel have been taken to man the field hospitals, as it happens in Varanasi, Ahmedabad, and Lucknow, which are all associated with the Prime Minister, the Home Minister, and the Defense Minister. So, there is a certain subtext. So, Philip, can you respond to these two issues?
See, I agree that the focus of the military should be on its primary role. And to that extent, last year, when this crisis has started, we also had the Chinese intrusions in Ladakh. But now, a year later, when we are facing the second wave, the Chinese intrusions and the security situation in Ladakh has somehow cooled down to a point that the military is confident that whatever is going to happen in Ladakh, the resources are there in Ladakh to look after that limited security situation, and that limited security situation is not likely to spread into a full-scale confrontation, which we were not very sure about last year. So there is a feeling today that whatever is happening in Ladakh can be handled by the troops who are already there. And in the meanwhile, in this last 1 year, we've had a look as to what all we can do. I agree that primarily this is not our primary job. This is the job mandated to the National Disaster Management Association, the National Disaster Management Authority, NDMA.
Yeah.
And there are lots of disaster units which have been created to deal with natural disasters, one of which is such a pandemic situation. Unfortunately, lesser attention and priority was given to the pandemic. So though it is mandated in the role of the NDRF, they really did not have the capability. So when the NDRF or those who are mandated to do this job to assist the government in an emergency response. If they are incapable or ill-prepared as of now to do this, then we fall back on the army, who in any case was required to do this as its secondary role. So I'm just looking at it. This is not an ideal situation. This is not what the military would prefer to do. But in the current circumstances, when things happen to be quite chaotic, people are not sure as to how this whole thing is going to be handled, then we have got a disciplined force, an efficient force, a force which is very large, which the writ runs right across the length and breadth of this country. We can move very fast to any part. And we have already done a lot of it towards COVID mitigation. And at some stage, I feel in the near future, we should expand the role of the military using the facilities which are already there and more which are underway to help in the vaccination process.
Philip, one second. I just want to push you, Philip, just one issue. If I could just push you a little bit on this. You being the DG perspective planning, you headed the Western Army as the Army commander. You've been vice chief. My specific question to you is, with the existing HR constraints that the Army has, particularly as far as medical personnel are concerned, can this be sustained? That is an issue that I've also raised in other fora. My own sense is that it would be imposing a very severe strain on the system, and it could degrade primary responsibilities. So I want you to respond to that, Philip. And if you don't agree, please say so, because we want to have a little light on this issue.
See,
Philip?
Ideally, in ideal circumstances or even not so ideal circumstances, the army wouldn't like to come in. And the army is not, in terms of manpower, most of these military medical units are not holding personnel up to their authorization. So as it is, their manning levels were less than optimal. And then you have a situation like this. Military people themselves are facing the ravages of the COVID. All the military hospitals are full. There are many fatalities among the military people also. So in these circumstances, to provide medical personnel and resources is difficult. It's difficult. But starting last year, this model of this COVID care centers, where civilian resources, even corporate CSR funding, and even the DRDO, they have come forward to put up the temporary infrastructure for these facilities, provide equipment, provide medicines. The military provides the overall sort of supervision, provides a certain number of manpower, and then helps the civilian manpower along. And so you've got lots of models working. You've got military facilities which are willing to accept 10 to 15% of civilians affected by COVID, provided they have the space for them. Then you have got these COVID facilities created by DRDO or by civilian organizations where the military is only manning. And then there are many other models. There is a Patiala model, there is a Chandigarh model, where, say, a government hostel, the government takes over the running and then looks for some sort of supervision by the military.
Thanks, Philip. I think this Patiala model is a good example. I'm going to turn to Dr. John. Professor John, Philip has just spoken about the Punjab Patiala model. I mean, Patiala has other resonances. We won't get into that just now. But we have a Bombay model, which is the way in which the city of Mumbai has dealt with the COVID, and the senior civil servant there has been praised for the manner in which he's dealt with it. But if you are looking at Tamil Nadu, you have been there for a fairly long time as a professional. And you heard these two experts, Mr. Desiraju and General Campos. Is there anything that you can see as the equivalent of the Tamil Nadu model? Also, given the fact that Tamil Nadu as states has invested in the health workers at the district level and at the village level. This is my anecdotal reading of the capabilities and the capacities of individual states in the health sector. So you, sir, I'm sorry, I did not let you finish your earlier thought. So related to vaccination, or any other of the priorities that you identified, whether it is the serving military or the retired personnel, is there something that you could outline which is Tamil Nadu specific? Professor John?
Thank you. First of all, on behalf of the armed services, I'm asking this question. Are we asking a question that the epidemic management infrastructure of the government should be asking and identifying a role that the military can play? That would have been the right way to come to this kind of a forum. That is not what's happening. The military is asking, what can we do to help? And that is why I brought the issue of a sense of discipline, because the entire pandemic management is not well organized. I wish we had learned the army language of strategy, tactics, and logistics and moved us on a war footing. That did not happen. So right now we are talking about immunization. So once the government decides if we go by priority or if we go by equity principle, and so throw it open to anybody above 18 years of age to get vaccinated. That is I think, a very important decision. And if I were in charge, I wouldn't do that. I would put my priority for saving lives. Anyway, so the government has to decide what model they're going to use. And once that is defined, the military will have a definite role in establishing, helping the government machinery to apply a disciplined way of distributing vaccine and seeing that the vaccination clinics are done well in a city or a town or in a rural block. That helping hand, either veterans or the present military giving their time and their expertise, can be done. But this model has to be thought through. I don't think we can volunteer and say we will do this and that.
I think that's a good point, because in any democracy, the military cannot volunteer to do something. It has to be directed by the civilian political apex and the rest of the system. I think that part of civil military is well understood and respected in India, which I think is a very positive feature. So even now, the military does what has been assigned to it by the parliamentary form of governance, with the Prime Minister at the very top. But Mr. Desiraju, if I could request you to come in at this point on two issues. You're in Chennai, and we have spoken about different models. You had made, I think, a very pertinent point, and I would like to say I agree with you, that I think I would be very cautious about, for instance, getting the military involved in the distribution of medicine. I mean, that is something that is done under the state arrangement, different hospitals, there are different models. But if we talk about a role as the pandemic, it's been called unprecedented. It could have a very severe human cost in case it goes unchecked, if the variants are going to be as malignant as is feared. Just a hypothetical question for Tamil Nadu as a state, which has its own characteristics. Do you envision any role for the retired military community who are resident in Tamil Nadu, whether they are doctors, whether they are nurses, whether they are paramedical staff, to assist and enable whatever be the current effort being done by center and state within the state of Tamil Nadu? Mr. Desiraj?
Well, absolutely, yes. And this is not necessarily only true of Tamil Nadu. Just General Campos said that, retired military medical people are settled in their hometowns across the country and could be requested, urged, encouraged to offer their services. This is likewise true. And I believe many state governments in the north, where the medical departments are chronically understaffed, have used this even in other times, not necessarily only now with the pandemic time. There is certainly a case, but whether it is doctors, nurses, we have a large population of retired nurses living in Tamil Nadu. Doctors, nurses, allied health people who certainly this is a time of crisis when they should be called back. And I believe Tamil Nadu would be responsive, given what one knows of successive governments in this state. They would be responsive to public health means something in this state. And I'm sure that would happen. I just have one quick comment on something that was said earlier. You very correctly complimented the officer in Mumbai, Mr. Chahal. I mean, an outstanding officer doing extremely good work. But we should not forget one thing. He has been allowed to do so by his chief minister. You know, there are civil servants across the country who are capable of good work, very hardworking, intelligent, dynamic people who would do wonderful jobs if they were allowed to do so. What Iqbal Singh Chahal's story tells us is that you have a chief minister who allows his officer to do what he's supposed to do, and you see results. This is unfortunately a lesson that we have to learn again and again in India. Thank you.
No, I think absolutely. I'm so glad you mentioned this, Mr. Desiraju, because if you look at the Indian story over the last 50 years, wherever there has been the equivalent of a national success, for instance, the Green Revolution, or if we talk about India's milk story, the Blue Revolution, the White Revolution,
Right.
I think by and large, it has been enabled by a political leadership that has given space to the professionals. I mean, we could say the same thing about Prime Minister Narasimha Rao and the economic liberalization,
Yes.
where he was enabled by a whole bank of professionals led by Dr. Manmohan Singh as the minister. We haven't seen that as yet, but we hope that this will happen. But that's a very important observation. Thank you. You know, in conclusion, I just want to leave this thought saying that the COVID pandemic and the vaccination effort are likely to engage India and test its institutional resilience in the course of this year, that is 2021. All hands on deck is a familiar phrase. I'm a sailor, I'm using it. And that is the clarion call for India. That is actually Bharata. And all institutions and individuals will be called upon to do what is expected of them, to discharge their swadharma, their assigned responsibilities and obligations, and this flows from the political apex right down to every citizen and institution. I hope it happens. On that note, let me thank my guests, Mr. Desiraju, Dr. John, and General Campos. Thank you for watching Security Analysis. We will be back very soon.